Yo, what up, GPs? I'm Dr. Jared Williams. I'm your third molar expert. And I know this is a little bit different, but I had a request to plan implants for this YouTube channel. And since I want to make sure that the viewers of this channel get the insight that they want, I want to go ahead and give you some counsel on how to plan implants with BlueSky Bio. All right, let's jump into it. All right, so here's a software. I went ahead and I already set the curve, and that's going to be this yellow line here. As you can see, as I shorten it, it cuts off. As I elongate it, it makes it more pronounced on the data that's going to project on this panel. So you could probably already see that I'm going to be placing implants at site 8 and 9. That's if there's enough bone here. So now that we have this out the way, what I want to do is this. I'm going to take my indicator and put it on the site that I'm going to be placing this implant. Now we could see here that this bone is very, very thin, and I'll jump into the screen here. You see it's very, very thin, but I'm not real big on measuring with a ruler, as you could see in tools here, right? Using this tool. I don't use it. What I do is I go straight to the actual implant that I'm placing. Now, like you learned on other videos before, when I'm placing implants, I have a default implant already in my mind, a 4.3 by 11.5. Well, I already know that this is going to be too small for that. So what I'm going to do is this. I'm going to go ahead and drop to add implant. I'm going to get a 3.5 by 11.5, and I'm going to go ahead and drop it in.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now, and let's embark on this exhilarating journey together.
Now that we have our implant in here, you could clearly see that this implant is sticking out of the bone. Now, this is exactly what I want. I will go ahead and place it in here, and I'll just mirror it out to where I want this actual implant to go. And it'll make more sense when I'm finished. All right. So we have a 3.5 millimeter implant diameter wise and 11.5. So if I wanted to, I could actually take this a lot longer. But in this particular situation, this seems to be okay with this position and the amount of space that I have buccal lingually. Now, I'm pretty sure all you implant gurus are thinking you can't place this implant here because there's not enough bone. Relax, tiger, relax. So this is going to go for implant number 8, site 8, and then we're going to drag it over here to number 9. And all I want to do is see how much bone I could actually get in this area. And as you can see, it gets to the midline, it gets very, very, very thin. But once I get over here to site number 9, I have a little bit more wiggle room. So what I'm going to do is this. I'm going to go ahead and enlarge my screen and drop another 3.5 millimeter implant by 11.5. So I got the right one. Drop it in the spot. And then I'm just going to orient it in such a way that it will work for restorative purposes. All right. So as you can see, we have plenty of bone apically, so we could literally start tracking this all the way back, but I'm not going to do that. So when I zoom back out, I'm going to look at my pano and see that this bone is pretty adequate for what I'm going to actually be planning. And you can know BlueSky Bio, it turns red if it notices out a bone too much. So what I'm going to do is this, I'm going to just slide it over here just a little bit so we're not on any roots. And this is essentially what it should end up looking like once we actually do the surgery. But when I want to use this cross section, this axial view, so we get an idea of where these implants are going to be placed in bone. So this is the back of the person's head. This is the front, where the front teeth are. So what I'm going to do is this, I'm going to work my way up and see exactly where those implants are. Are they actually in bone or are they not? And they're not coming up here. Here we go. So what I would do is this. I see my implants, and I'm just going to trace it up just to see exactly where they are. Are they actually in bone? So what I'm going to do is I'm going to turn off my cross section, and I'm going to turn off my dental curve so I could see exactly where this implant actually is. Right? So I am literally going coronally, and that's why the implants are actually gone. Now I'm going apically to see if those implants are actually being found in bone, and it really is. So we're not touching tooth number 10, and we're not touching tooth number 7 here, right? So now that I know that I'm actually in bone, now that I know from this cross section and this apical section, now this is where the magic happens. This is exactly why I say don't rely on CT scans, because they're going to end up causing you to lose your mind and miss out on cases. So what I'm going to do is this. I'm going to go ahead and remove this implant. I'm going to do the same thing on this one, just so I can get an idea of what I'm working with here. All right. So now that we have the implants completely gone, the reason why I say don't worry about the amount of bone that you have on CTs is because if you know how to place implants, you already know what I'm going to do next. So what I'm going to do is this. Now we could look at the measure. Now I never do this when I'm doing cases, but just for all those docs that are just like, you know, what happens next, then I'll just measure to see how much bone we actually have. So right now we have 4.83 millimeters in this particular area of bone. Right? This is about the mid aspect of the alveolar height of this bone here, 4.8. And that's pretty consistent all the way down until you get to the coronal portion, or the more apical portion of this bone, or coronal portion of this bone, alveolar height, I should say. All right, so we have that there. So we know that this is how much bone we have. So what am I going to do? You should already know. We're going to use osteodensification burrs. Now, what osteodensification burrs do is they allow you to keep the medullary bone intact. So what I'm going to do is I'm going to get a burr or drill, and I'm going to go about 2 millimeter drill. And this drill is going to allow me to condense all the bone from the height all the way to the base of the bone here. And as you can see, that's going to compress all the bone towards the cortices of this bone here. And when that happens, you're going to have higher implant bone implant contact, or BIC for short. And that BIC allows you to load implants and have greater osseointegration, because the bone to implant connection is going to be so much greater opposed to me just doing a regular osteotomy. And so that's why I want to just give y'all some insight when you're planning these cases, that if the bone is too narrow, don't be so quick to send the patient out. Get a CT scan to see how much bone you actually have, because if it's too thin, then you're going to find yourself in some trouble. So let's just go to the other side. All right. So this is going to be 210, 210, number 10. We're going to come right next to it. And so essentially I'm going to do the same exact thing. I'm going to measure this out from here. 4.6. So as you can see, this is a little bit thinner than the other site. So what I'm going to do again is I'm going to get a 2. I'm going to go 2 millimeters into the bone with basically a pilot drill. And then since it's a 3.5, I'm probably going to go to like maybe a 3 for osteodensification and then place my regular size implant. And so it's basically as you're spreading bone or a ridge split or like a modified ridge split. And so that's how you go about planning these types of cases. In this particular situation, I wouldn't think of doing a ridge split. I don't think it's necessary, just for the simple fact that I would have to cut the bone from here to here and then do the same exact thing, osteodensification. In this particular situation, what I'll do is this. I'll let the patient know, hey, there's a likelihood for us to be able to place these implants based upon the bone that's present already. And in the event that we can't, we will still go ahead and graft the areas just so that we could bulk up the facial aspect of bone that's present, just so we have a real nice implant surgical procedure that's actually transpired. And as long as we get bone encased, implant encased in bone circumferentially, about good 2 to 3 millimeters of bone, then we'll be good. On a case just like this is what the patient's actually being faced with. I know it's a little fuzzy on your screen, but this is what we're working with. And the good thing is this, there aren't any significant depressions by the anterior nasal spine. But when I do go ahead and place these implants, what I will do is this. I will decorticate the bone around here, and I'll put a good amount of bovine bone on the facial so we could bulk it out. But I want to say this patient's going to end up having a wonderful result. Hopefully we get the surgery done soon so we can give you some before and afters. Outside that, docs, this is how you treatment plan your implant cases on BlueSky Bio Plan 4 with an atrophic ridge. All right, docs, I'm Dr. Jared Williams, your third molar expert. But if you're wondering why are you talking about implants? Because of this. If you're faithful over a few things, you'll be made ruler over many. Make it a great one.